welcome to today's edition of Diplomatic Passport, your daily weekday COVID-19 show that keeps you up to date with Zimbabwe's COVID-19 effort, as well as regional and global trends around the pandemic. My name is Blessing Munatse, and this show is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. Now, as usual, we start by taking a look at the latest figures released by the Ministry of Health and Childcare yesterday. 92 new cases of COVID-19 were recorded from 6,246 tests. This represents a 1.5% positivity rate, taking the number of active cases to 1,800, and 3 deaths were recorded, bringing the cumulative fatalities to 4,648. The cumulative number of COVID cases now stands at 132,108. Zimbabwe also currently has 67 hospitalized cases of COVID-19, and of these, 6 are new admissions, 7 being asymptomatic, while 46 are mild to moderate cases. 12 of those admitted have severe symptoms, while 2 are in the intensive care unit. Let's take a look at the ongoing vaccination program. Yesterday, 7,962 people received their first dose. Brings the cumulative for the first dose to 3,191,276, while 12,096 received their second dose, to bring the cumulative for the second dose to 2,440,636. So 2,440,000 people have been fully vaccinated since inception of the program. Now, today, the World Health Organization on Wednesday launched an expert group that will examine the origins of new pathogens, including the SARS-CoV-2, that's the coronavirus that causes COVID-19. The proposed members of the WHO's Scientific Advisory Group for the Origins of Novel Pathogens, that's SAGO, were selected for their expertise in areas such as epidemiology, animal health, as well as clinical medicine, virology, and genomics. WHO Chief Dr. Tedros Ghebreyesus announced this during his regular media briefing, and this comes after a public call was made to the World Health Organization in order to investigate the origin as a way to put to bed theories like the 5G radiation theory, but the chief amongst them was the Wuhan lab leak theory. Now, more scientists have said that SARS-CoV-2 probably has a natural origin and was transmitted from an animal to humans. However, a lab leak has not been ruled out, and many are still calling for a deeper investigation into the hypothesis that the virus did in actual fact emerge from the Wuhan Institute of Virology, located in the Chinese city where the first COVID-19 cases were reported. Now, the Wuhan lab leak theory has been broadly dismissed by most scientists as a fringe conspiracy theory. Here's the WHO Director General.
Following a public call for experts, WHO today announced the proposed members of the WHO Scientific Advisory Group for the Origins of Novel Pathogens, or SAGO. The 26 experts were selected from over 700 applications and were chosen for their world-class expertise and experience in a range of disciplines, as well as their geographic and gender diversity. SAGO will advise WHO on the development of a global framework to define and guide studies into the origins of emerging and re-emerging pathogens with epidemic and pandemic potential, including SARS-CoV-2. There will now be a 2-week public consultation period for WHO to receive feedback on the proposed SAGO members, following which the composition of SAGO will be confirmed and the group will have its first meeting. The emergence of new viruses with the potential to spark epidemics and pandemics is a fact of nature. And while SARS-CoV-2 is the latest such virus, it will not be the last.
Now, we spoke to the Director of Laboratory Services in the Ministry of Health and Childcare, Dr. Raiva Simbi, who said such research is critical in strengthening health systems within the effort of coming up with solutions.
You know, the way that COVID started, there were so many theories because it was a new disease. So as such, you really need to confirm where it came from. But what's known for sure, it's a zoonotic disease. And when you say zoonotic, it's coming from animals to humans. So now then you need to be so sure where it came from so that in the future you can either control the population of the vectors that actually transmit the disease to human beings. And also in public health or in epidemiology, you need also to track down the origins so that you avoid next infection. So even if it took us time to respond to COVID because that information was not available, but it did mean it was available, then the scientists could have gone to the source, just kept the disease at the source, and quarantine that area so that there was no transmission from that place where it started, Wuhan, to other places in the world.
Well, as we head towards a close, the emergence of COVID-19 has actually had some innovations in as far as solutions around the pandemic are concerned. A Zimbabwean app developer based in the UK, Munya Hoto, founded an online platform that's called Text Aid, and that allows COVID-19 patients to self-report, a process they hope will ease contact tracing and also allow for easy checkups on patients who are asymptomatic, with no need to be hospitalized.
When the COVID-19 pandemic struck Zimbabwe, we took a look at our platform and wondered how we could leverage the technology that we've developed to be able to help the government of Zimbabwe with our partners at the Ministry of Health. I'm very proud to say that the team worked night and day to be able to deliver a response system that allows for the possibilities of self-reporting, contact tracing, and managed health information delivery. We've been working with the Ministry of Health and Childcare for some time now to be able to make this tool available to the public of Zimbabwe.
Well, that does it for today's edition of Diplomatic Passport. Thank you so much for making us your choice. We're back again tomorrow, same time, same place, same channel. Do make a day with us. And this program is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing Manatsi.